Learning objectives. We'll cite the reasons discussed for more children being prescribed psychotropic medication in the U.S., including the increased diagnosis of treatable conditions, increased access to safe medications, and increased trauma-related disorders in children. We'll explain the 4 ethical principles on how they apply to prescribing psychotropic medications in children. We'll evaluate the societal and cultural factors that may influence whether medications are used to treat mental health disorders in children. We'll analyze concerns regarding the use of psychotropic medication in children, including overprescribing, failure to consider behavioral approaches when indicated, polypharmacy, and inappropriate use of off-label medication. We will apply knowledge to specific case studies, including assessment, diagnosis, treatment, and evaluation of outcomes. We will also examine approaches used to discussing ethical principles related to prescribing medications with parents of children with mental health disorders. And then I will say, we'll also get an adult perspective as well. As I've mentioned, go ahead.
I'm sorry, I'm getting notes. Before we move into all of this incredible information, I wanted to put the first code word out there for everybody. Write this down so you'll get quizzed on it. The first code word is puppy. Sorry, Karen.
You're a good word today. I have been doing webinars for 11 years. I've had the privilege of being able to work with amazing people and learn so absolutely very much. Psychopharmacology was not really necessarily a topic that one would associate with the business that we typically, the education that we typically provide, which is applied behavior analysis. And the core of our business is really about education, providing the educators, the providers, and the parents with the access to information, resources, tools, and knowledge that they need so that they can make better, more informed decisions has always been the mission of our organization. And we started with applied behavior analysis, and so ABA is at the foundation of everything that we do. And autism, as you guys probably know, when people think about applied behavior analysis, it's synonymous with autism. And I think that's really good that that's the case, but ABA has so much value above and beyond just autism, and I am actually learning to appreciate that in my own personal situation that I could be a beneficiary of applied behavior analysis as well. And so a little bit of history in terms of psychopharm. I had bipolar. I was diagnosed 12 years ago. I've been on medication for 12 years, and I've been under the care of 5 different psychiatrists, God knows how many primary care physicians, and a whole host of other people. I just recently had a very, very personal episode that I had to go through that is related to ethics of psychopharmacology. So I thought I'm just going to insert myself here and learn a little directly from the experts, and then be able to use my personal experience to show you guys the implications of what happens when unwittingly the providers that were supposed to be taking care of me and the healthcare system completely failed me to the point where I am today. So bipolar, I'm on a medication called Lamictal, and I've been on it for 12 years. We kept increasing the dosage because, it's not working. I talk about the side effect, put me on different medication, didn't work. I went back on Lamictal. But over a period of years, the biggest side effect for me about being on Lamictal is cognitive impairment. That's been an issue. And but I decided that was worth it because it was kind of like a cost benefit. I could either not be on medication and be not be functional, which is not not an option for me, or be on medication and have to deal with the side effects. So most everybody that's on medication probably has to deal with some sort of side effects. When you're on medication, and the doctors will be speaking about that, and it's affecting your brain, the side effects tend to be a little bit more severe, I guess, or impactful to an individual's life. About 5 years ago, out of the blue, I started to experience side effects of vertigo, the most bizarre thing in the world, and to the point where it was debilitating. And again, it was the cost benefit. Well, do I want to change the medication and then have to deal with a completely different set of side effects, or do I just stay on and deal with it? And it was intermittent. I decided I'm just going to deal with it. And maybe I was lazy. I just didn't want to go through having to see another psychiatrist and, tapering down and getting back up. And, as a patient, it's not the easiest thing in the world to switch over from one medication to the next medication. I was in Chicago with visiting family in July, and I had a vertigo episode that lasted 3 full days. I was debilitated.